And till recently, people didn't realize the importance of these bacteria. People didn't realize that they determine, you take a medicine, how the medicine acts is not because of the medicine itself, but what happens to the medicine when we take it, how the bacteria acts on this and changes the medicine. So everything determines on this. And some very interesting experiments have come recently, and one of this is that people think about, some people, they say, is obese, they're trying to cut down the weight, they do dieting, they're exercising, but they're not coming down. It's a common complaint we get. They get surgeries done, but they don't decrease their weight. So what determines what happens actually is not, or there are some factors which are like this, which are important, but more important is the gut bacteria. And this is a very interesting experiment that was actually published a few years back, where bacteria from the intestinal tract were taken from mouse which were very obese and given to normal mice, and this mouse which was normal became obese. If you gave it to a lean mice, the lean mice became lean. So you can actually give bacteria from the lean mice to the obese mice and it became thin. And so now people are trying to make capsules. Of course, when you say bacteria, this is actually the stool sample of the mice that were taken, given. So people are now trying to make capsules from these bacteria to see if you can actually give this so that you can change the whole body contour. This is still ongoing research. So when this comes in, then all these concepts of diet and exercise and everything goes off. But till that time, it still holds true. So I'm not going to talk about how to live well, because all of you know what healthy thing is, eating adequately and all that. What I'm going to talk about is death. And I think it's appropriate after hearing your talk on what happened in the valley there. It's a strange coincidence that this happened to me, the main brunt of my talk. The reason I'm going to talk, this is I think, interesting book. If none of you have, anybody read this book? Big Mortal. If you haven't read, you should go and buy this book. This is written by a physician called Atul Gawande. Atul Gawande is a second generation Indian who is working as a medical professor in Harvard. He's written several books. I'll show you some of that. But this book was written last year, and President Obama picked it up as the best book that he had read. And immediately after he did this, the book, of course, became a big hit. He actually hails from a nearby place called Nanded. He's a brilliant doctor who's written a series of books for lay people from doctor's view. And this being mortal was important because in the American aging population, they're not concerned about living healthy now. Many people after the age of 60 or 70 years start thinking about how they're going to die, which is the best way to die. Should they die in the house? Should they die in the nursing homes? Who will look after them? And all sorts of things, So that has become the main concern for the American population. So I initially thought maybe it's not very important for us. For us, struggle every day trying to live, maybe death is not important. But we realize that as we go on, that this is a very important fact even for our society. As we start to age, as we see, we get many children getting the elderly patients. Some of them are living abroad. They can't spend time with the parents. They want to know, is there a place where we can leave them so they can be happy in the last days? We get children getting their parents who have terminal cancer. They want to know how they can be comfortable in their death, the terminal phase. So this is something that we face very often. And as doctors, what happens is we are trained to keep people alive. We are not trained to treat people who are dying. We are not trained to console them. We are not trained to discuss with the family what to do and so on. This is a major deficiency we have. That's a problem. So this book actually discusses all this, and I think it's an interesting book that, anyway, at least for those who are above 60 years should buy this book. For younger people, it's okay. They can wait till they reach that age. So the reason why we die, of course, first is accidents, including earthquakes. It's also because of old age, which is a consequence. Everybody has to die sometime. It may be 60, 70, 80, 90. It may be because of infective diseases, which are largely preventable. It may be because of lifestyle diseases. Diabetes, hypertension, obesity, all of these are now preventable, and that's what I told you in the first slide. It's a large number of people die because of cancer, and this is something which I'll discuss a little, how probably we can try and look into this. And of course, the last important cause is doctors themselves. Doctors also kill patients. So this is not a very important cause, but still it's an important cause. Now, there are of course accidents, people die, some of them we can't prevent, some like this we can prevent actually. In fact, this is very interesting that if you look at all over statistics all over the world, women live longer than men. So very often couples come and discuss with us. So I always tell the guy that you are going to pass. So take care so that you prepare for everything so that your wife is comfortable the next 3-4 years, because men tend to live. And this is this is the WHO statistics. This is very interesting that all over the world, women in more advanced countries, for example, they live 10 years longer than men. And even in India, if you see, in general, these are general statistics, they're 5 years longer than men, average age of death. So they live longer. This is because, again, genes, and they probably, again, there are several studies that show that they are not prone to certain types of cancer which men are prone for and so on. So there are several reasons why this happens. So, as I said, accidents we can't do anything, and old age is a natural consequence. The way we actually prolong life in human race as such over all these years is because of conquering infective diseases. About 30-40 years, people used to die of tuberculosis, typhoid, and so on, all simple infections. But this has changed dramatically. And most people would think that because of modern medicine, lifespan is advanced. This is not right. The lifespan expectancy has increased mainly because we have been able to give better food, immunization to prevent certain types of infections, clean drinking water, sanitary facilities and all that. These are the things actually which has dramatically increased the human lifespan, and not modern medicine. Modern medicine has made a very small difference, so it doesn't matter at that stage. And I'll show you an example of this. This recent Ebola virus, you've been reading in the papers, a lot of Ebola virus coming. There were scientists working at least in 70 countries looking very closely at the Ebola virus. They actually completely sequenced the whole gene of the virus. They knew how the virus grows. Then they're trying to work at various antibiotics to try and kill the virus. But in spite of all this, the virus started proliferating. It was actually taking over many countries, Sierra Leone and Liberia, and all of them were completely engulfed from this virus. And it was believed that at one point of time that whole Western Africa will be wiped out by this virus. And there was a lot of alerts. People are trying to see. A lot of funds were granted by different agencies to try and control it, but nothing controlled it. But what you now know is everything is controlled. Controlled by simple technique. The control was they isolated the patients having this Ebola virus infection completely. And once they isolated, it didn't spread to other people. And the whole virus is now under control. There are just 3 or 4 cases in each country now. They control it. Just simple thing. It's not modern medicine, but a simple physical isolation of these patients with this virus infection. So modern medicine gets a lot of credit for things, but I think it's important that these simple things actually make a difference in a lot of lives of the patients. The one thing that I think we've been able to actually make a difference is in patients with cancer. Now, if you look at statistics again, you will realize that these are statistics again from WHO, that what are the cause of deaths in our country. You'll find that cancer deaths because of either gastric cancer, liver cancer or colon cancer is one of the leading causes. After that you have breast cancer. So now these are the types of deaths that can be prevented. This is something that again the modern medicine can do, and I'll show you an example here. I don't know how many of you recognize this lady. She's Kathy Curie. Kathy Curie was a very well-known anchor in NBC TV, United States. Her husband was 45 years, developed a colon cancer. This was many years back when there's no concept of actually looking for cancer screening and all. So he developed colon cancer and was operated. It was too advanced and he died. So Kathy Curie decided that it was a mission to spread this awareness, because colon cancer is something which can be detected early and prevented, because all the cancers in the colon come from a polyp. And these polyps are there for at least 5 or 6 years before the colon cancer develops. So the concept was that if we screen people after a certain age and find polyps, we remove them, they can prevent cancer. This concept was not there when her husband died. And she realized that this concept can come in. And what she did was, she was about 40 years at that time. She went in front of the TV, NBC, and got herself colonoscoped. This was the most watched TV program in the United States at that time, at least by men. They all wanted to see Kathy Curie being colonoscoped. So, but what it also did was that it made this procedure extremely popular. It forced the government of United States to come out with the legislation that said that everybody after a certain age, it was initially 60, came to 55 and then became 50 years, should have colonoscopies done. And consequence to this, now colon screening has become one of the most important health issues in the United States. Everybody after 50 years or 55 years gets a colonoscopy. Any polyps detected can be actually removed. And it has been very clearly shown in the last 10 years, the incidence of deaths because of colon cancer dramatically decreased in the United States. Now, you can't do this in India because such a large population, already the gastroenterologists you can see are so busy, they don't have time for many things. So, if you start screening all the population of a certain age for colon cancer, it becomes extremely difficult. But this is the legislation that has come in some countries. For example, in Australia, if you don't get yourself colonoscopied after the age of 50 years at least once, you have to pay a fine of $500 every year to the government. So, it's such a legislation. So, as I said, this is very difficult to implement in our country for several reasons, economic reasons and so on. But this is clearly one of the areas we've shown that you can actually prevent a disease, prevent colon cancer, because we know of several, I think some of you here also have had incidences where friends or known people have suddenly come up with colon cancer, terminal stage, nothing can be done and they die. But these are something that could have been prevented easily if at least those in whom have a family history of colon cancer, families of other cancers should get themselves colonoscoped at least to prevent this. This is actually the only gastroenterologist who got a Nobel Prize. This is Barry Marshall, and I think Dr. Rupa knows him well. So Barry Marshall was the one who discovered that there was a bacteria in the stomach. It's called Helicobacter pylori. And this Helicobacter pylori is responsible for ulcers, for a variety of things, including cancer. Almost all the cancers in the stomach are caused by this bacteria, Helicobacter pylori. And if again, when we do an endoscopy, when we actually put a tube through the mouth and look into the stomach, we always take biopsies to check if this Helicobacter pylori is there. So again, if somebody has a family history of these cancers or a lot of people in that area have cancers, then we do this screening where do endoscopy, take biopsies, check for the bacteria, very simple. If the bacteria are there, or a certain type of bacteria there, the chances of this cancer coming is very high. And then we can actually monitor this very carefully and take out the early areas of cancer without surgery endoscopically. So again, this makes a lot of difference in the lifestyle. This is something I think you must have again read. Angelina, she had breast cancer, and certain genes which are responsible for breast cancer, we now have, they're called BRCA1 and 2, have been identified. And these genes now, of course, in our medical society, there's a lot of debate whether Angelina did the correct thing or not. Many doctors feel it was not right, she could have waited. It was more like a hype in the news that came up and all. But anyway, that's a different issue. But generally, there are now some cancers, especially cancers of the liver, there are certain cancers of the intestines, which have a genetic basis. And we now have methods to detect that. So if there's a family history of cancer, this is very, very important because these are genes related. If there's a family history of cancer, then we almost always try and check for these genes, and if there's an abnormality in these genes, then we can actually trace very carefully whether there's a chance of cancer, and then this part of the intestines, so all can be removed. And most of the time this is removed through a minimally invasive, without surgery. So this can be done. What is the unfortunate thing about this cancer is this, that there is so much coming in the lay press. You know, this is something, again, like one of the myths that you described, this is something you should never believe in. Whenever you see a headlines like this, cancer cure found, don't believe it. Because if the cancer cure is found, this person will get a Nobel Prize, get everything else before it comes into the newspaper. So a cancer cure will never be found like that overnight. But this is something that you will find very commonly. And this is very unfortunate because not only Indian papers, in fact, even Times had this, very reputed paper. They had how to cure cancers. The headline was very striking, but when you open the thing and read, you will realize that they're talking about this preventive aspect, the colon screening and so on. So right now we don't have, once you have an advanced cancer, we don't have methods to cure the patient, but we can actually prevent many of these gastrointestinal tract cancers are open to investigations, and many of them can be prevented. The other problem, again, this is something that lay people don't know, but doctors realize it, that if you look at what is happening in cancer research,